that all of us are either in this together or we're not. You cannot have a pandemic in part of the world and not in others.
A call for more collaboration from the World Health Organization. As more cases of Omicron are confirmed in more parts of the world, vaccine nationalism is growing and more jurisdictions are looking at widening booster programs.
We're continuing with our booster dose strategy as well. We'll have more to say about that with respect to age categories within the next few days.
That's in spite of the WHO asking countries to instead divert doses to lower-income nations.
Right now, there is no evidence that I'm aware of that would suggest that boosting the entire population is going to necessarily provide any greater protection for otherwise healthy individuals.
Despite millions of doses being donated, global vaccine inequity remains massive. Consider that just 1.7% of Nigeria's 200 million people are fully vaccinated. Compare that to more than 75% of Canadians.
I'm just coming out of Yemen. 0.5% of the population is vaccinated. So, it's a humanitarian nightmare.
Ethicists and epidemiologists say unvaccinated populations become breeding grounds for variants. Our Minister of International Development says Canada has enough doses for boosters and donations.
We've committed up to, right now, up to 200 million doses, the equivalent of 200 million doses. But we're more importantly working with the World Health Organization through COVAX to making sure it's an equitable distribution.
But experts maintain vaccine equity should be seen as a threat here at home.
If you're in a crowded building and you say your neighbor doesn't want to buy a smoke alarm or a fire extinguisher, you would say, well, I'll buy one for them and make sure that I'm safe. And it's exactly what we have to do here, is vaccinate the world to protect ourselves.
And until vaccines have reached every part of the globe, everyone everywhere can still be susceptible. Mike Le Couteur, Global News, Ottawa.